is Karen Vinsek, and I am presenting my evidence analysis on intermittent fasting. Here are the main objectives for this presentation. Intermittent fasting is a regimen that cycles between periods of fasting, which means no or very minimal food intake followed by periods of unrestricted intake. It's important to note that this trend is not new. In fact, it dates back to ancient times. Hippocrates, who is regarded as the father of medicine, recommended fasting for healing and said, "To eat when you're sick is to feed your illness." Thousands of years ago, it was believed that fasting helped with cognitive and athletic abilities. Among certain cultures, fasting was used as a means to connect with spirits and see visions. Fasting for religious purposes is a practice shared among all faiths, including Christianity, Islam, Buddhism, Jainism, Hinduism, Judaism, and Taoism. More recently, over the past 10 to 15 years, intermittent fasting is being used for weight loss as the United States faces staggering levels of overweight and obesity across all segments of the population. When it comes to weight loss, standard daily calorie restriction diet plans have shown to produce limited results, and it's been demonstrated that people are able to adhere to these diets for 1 month at most. Intermittent fasting has become appealing to many because the emphasis is on time restriction rather than food restriction. Proponents of it claim that this dietary pattern is associated with good mental as well as physical health and can elicit greater weight loss results than other calorie-restrictive methods, but the research in this field is limited. Here's a quick overview of the 3 most common approaches to intermittent fasting. There's alternate day fasting, where you fast for 24 hours every other day, and on the remaining days, you eat without restraint. For the most popular modified fasting regimen, there's the 5-2 method. This is where dieters fast during 2 non-consecutive days per week. And then on the remaining days, again, they eat without restraint. The most popular method for the time-restricted feeding protocol is the 16-8 method. And this is a daily fast of 16 hours and followed by an 8-hour feeding window. A literature review on intermittent fasting does show some compelling findings. Varadi et al. Conducted a study on intermittent fasting for weight loss. Over the course of 8 weeks, participants experienced a mean weight loss of 5.8%. They also had improved lipid profiles, decreased blood pressure. But unfortunately, this trial saw a significant number of participant dropouts, causing the researchers to conclude that this diet strategy might only be a good option for a specific segment of the population. Hajek et al. Conducted a study utilizing the 5-2 intermittent fasting method. A total of 300 adults were included, and they were divided into 2 groups. Both cohorts followed the 5-2 regimen, but one group received nutrition counseling 1 time in the beginning of the trial, while the other group received nutrition counseling multiple times throughout the trial. Participants were followed for 1 year. At the end, it was found that the extent of weight loss was similar between both groups, but the group with the highest number of participants that achieved weight loss was the one receiving the concurrent nutritional counseling. Once again, though, this trial reported high participant attrition. About half of the participants who enrolled were able to complete the study. Jamshed et al. Conducted a 14-week trial during which a total of 90 participants with obesity were allocated to 2 different groups, one that followed a time-restricted feeding protocol, while the other had an eating window of 12 hours. All participants received nutrition counseling throughout the trial. At the end, 66% of participants were able to complete the trial, and it was found that the people in the time-restricted feeding group achieved greater weight loss and body fat loss than the control group. Intermittent fasting appears to show some promise for weight loss, and this brings me to the following research question. In terms of weight loss and weight maintenance, are intermittent fasting diet approaches more effective than continuous calorie restriction diets in adults over age 18 with overweight or obesity? To answer this question, an evidence analysis was conducted, and these were the steps taken. First, the inclusion criteria was determined. I wanted to review primary research articles on community-dwelling adults ages 18 and up. Health status had to be overall good or with past medical history of hyperlipidemia, hypertension, prediabetes, diabetes, or arthritis. The preferences for study design were randomized controlled trials, randomized observational studies, and trials lasting at least 8 weeks. The size of the study groups had to be at least 10 individuals for each cohort. The dropout rate was not specified, and the year range was between 2013 and 2023. Excluded from this would be anyone under the age of 18, anyone institutionalized or with a serious illness. The problems or conditions that were excluded were eating disorders, pregnancy, breastfeeding, psychiatric disorders, cancer, weight loss surgery, and any religious fasting. Also, non-human trials were excluded. The databases used were PubMed, Medline, Embase. The keywords used were obese, overweight, BMI greater than 30, BMI greater than 25, intermittent fasting, time-restricted feeding, time-restricted eating, alternate day fasting, the 5-to-2 method, daily calorie restriction, caloric energy restriction, weight loss, and maintenance of weight loss. Here you can see my search results, the number of hits, the number excluded, and the number remaining of articles to review. The measurement tools that used were Evidence Abstract Worksheet Template and the Quality Criteria Checklist for primary research. The first study I'll review was conducted by Carter et al. These researchers tested the effects of weight loss and glycemic control utilizing the 5-to-2 intermittent fasting method compared to a daily calorie restriction diet over the course of 12 months. The subjects were adults age 18 and up in overall good health with a positive diagnosis of type 2 diabetes and a BMI greater than or equal to 27. Since the study participants had diabetes, an endocrinologist was consulted to adjust their medication regimens. One group of participants was randomized to the intermittent fasting diet. They fasted for 2 non-consecutive days. At most, on their fasting days, they could have between 500 to 600 calories. On the remaining 5 days, they could eat without restraint. The other group of participants followed a continuous calorie restriction diet, a diet plan for 7 days out of the week. Both groups were encouraged to increase their daily step count, and this was monitored using a pedometer. The study started out with 137 participants and dropped down to 97 in the end. Rates of attrition were similar between both groups. Regarding weight loss, it was found that change in body weight was similar between the continuous and intermittent energy restriction groups. Other findings were that hemoglobin A1C levels declined in both groups, but no differences were found between the two groups. It was concluded that intermittent fasting can be safe for people with diabetes, especially if they have diet-controlled diabetes or they use medications that are not likely to cause hypoglycemia. The authors also concluded that maybe intermittent fasting is superior to continuous calorie restriction among certain cohorts, because some people reported greater ease with adherence. The next study was conducted by Catenacci et al. This study was these authors conducted a study to evaluate the safety and tolerability of an 8-week zero-calorie alternate day fasting intervention. Efficacy of alternate day fasting was compared with a standard calorie-restricted diet for changes in weight, body composition, lipids, and insulin sensitivity index, as well as to compare risk for weight regain after 24 weeks of unsupervised follow-up. The subjects were between 18 and 55 years old. They had a BMI of greater than or equal to 30. They had to be non-smokers, and they couldn't have greater than 4.5 kilograms weight change over the past 6 months. And for the intervention, participants were randomized to either the alternate day fasting group, or a calorie restriction group. Throughout the 8-week trial, foods were provided. A follow-up assessment was conducted after 24 weeks. So in this study, resting metabolic rate was also assessed, along with levels of ghrelin and leptin. It was found in the end that there were no statistically significant differences between the two groups. And it was concluded that the total weight loss among both groups was similar. The alternate day fasting group achieved a greater degree of calorie restriction, loss of fat mass, and favorable changes in lean mass, but no significant differences in weight regain during the unsupervised time. But the alternate day fasting group gained more lean mass than the control group. It was concluded that the 0-calorie alternate day fasting diet is equivalent to moderate calorie restriction in producing short-term weight loss and improving body composition and metabolic parameters. Here's a study that was conducted in Brazil. For the intervention, which lasted 12 months, researchers set out to study the long-term effects of the time-restricted feeding regimen on body weight in low-income women with obesity on diets with the same energy deficits. The subjects were women ages 19 to 44. They had to have a desire to lose weight. They had to have stable weight for at least 1 month prior to the study. They had to be living in social vulnerability. And they had to meet 2 out of these 3 criteria: either a BMI greater than or equal to 30, yet less than 45, a waist circumference of greater than or equal to 88 centimeters, or a body fat percentage of greater than or equal to 35%. For the intervention, women were randomized to 2 different groups: a hypoenergetic diet, or a hypoenergetic diet plus a time-restricted feeding regimen where they fasted for 12 hours every day and had a 12-hour non-fasting period. At the end of the trial, it was found that both groups achieved a similar amount of weight loss. Also, the group with the hypoenergetic diet and time-restricted feeding regimen had a greater decline in waist circumference and body fat percentage, but these changes were not statistically significant. The authors concluded that intermittent fasting combined with some degree of calorie restriction could be a helpful weight loss strategy for those with limited resources. This study was conducted by Erdem et al. And compared the weight loss effects of several different diets. 5 different diets were utilized. Group 1 was on a calorie-restricted Mediterranean diet. Group 2 followed this same calorie-restricted Mediterranean diet, but they followed it every other week. Group 3 fasted for 18 hours a day and had a feeding window of 6 hours a day. Group 4 fasted for 16 hours a day and had a feeding window of 8 hours a day. And the 5th group followed an alternate day fasting regimen. The study subjects had to have a BMI between 27 and 35, and they had to be adults between the ages of 18 and 65. For the intervention, participants were randomly assigned and followed their respective diets for 12 weeks. This study began with a total of 360 participants and ended with 328 participants. In the end, it was found that one diet regimen didn't produce more results than the other. Anthropometric measurements decreased among all groups, but the results were similar between groups. Another finding was that the highest fiber intake was found in the groups that followed the Mediterranean diet. The authors concluded by saying that the calorie-restricted Mediterranean diet is preferred because it's been extensively researched and there's greater knowledge of the long-term health effects of this diet than there is of intermittent fasting diets for weight loss. After conducting this evidence analysis, it can be concluded that intermittent fasting regimens alone elicit weight loss results that are very similar to those achieved through daily calorie restriction. Limited evidence suggests a lower risk of weight regain exists with intermittent fasting when compared to daily calorie restriction. It's important to note that attrition rates with intermittent fasting diets were no different than that of other restrictive regimens. The grade that was given to the studies reviewed was grade 2 for fair, because a lot of the studies did have some shortcomings in their designs particularly. So here are some strengths and the limitations of the trials that were reviewed. One strength was that some of the trials mimicked free living conditions, but some of the limitations were that other interventions required study participants to rely partially or entirely on foods that were provided by the researchers or by the trial. Also, another limitation was that a lot of these trials required for participants to attend weekly clinic visits or meet frequently with dietitians or other study staff members. These are all requirements that really don't align with the typical diet experience. Also, most trials didn't examine levels of physical activity of participants or assess for weight loss maintenance. Another weakness of these trials were that some of them had smaller sample sizes. The ones that had smaller sample sizes tended to have longer durations, but the trials that had longer durations utilized smaller sample sizes. Each of these trials, or each of the trials that were reviewed, did have high attrition rates. And for the implications for research and practice for the future, it would contribute a lot to weight loss science if future studies on the use of intermittent fasting would explore larger sample sizes, or if they were of larger duration, ideally greater than 12 months, to really be able to test the possibility of weight regain. It's also important for study designs to resemble ordinary adult life as much as possible. It would also be worthwhile if trials could be conducted to investigate whether or not intermittent fasting could be suited for certain populations. It would be worthwhile to conduct studies that determine what the characteristics are of individuals who tend to have greater success with this intermittent fasting regimen. But one interesting finding from reviewing all of the trials that I found was that it might just be that this diet method might be helpful for those that are in social vulnerability, individuals with low income or low education, where they might not have so much access to low-calorie, diet-friendly foods. So thank you so much for coming to the end of my presentation. Here you have my references, and I hope that this was informative and enjoyed. Thanks.